Hello nurses, how are you all and welcome back to my channel Nurse Navigator Swati. I am back with the 8th part of Obstetric and Gynecological Nursing MCQ question and answers. Quickly go through my other MCQ quiz sessions, review your knowledge and do subscribe for more such MCQs. Let's get started. Question number 1. Which of the following complications is possible with an episiotomy? Options are blood loss, uterine disfigurement, option 3 prolonged dyspareunia or option 4 hormonal fluctuations postpartum. Within the given options, the long-term complication prolonged dyspareunia, that means the painful intercourse, is one of the more common long-term side effects of episiotomy. So here option 3 is the correct answer. Question number 2. Veera is in early labor, states that she has a thick yellow discharge from both of her breasts. Which of the following actions by the nurse would be correct? Option 1. Tell her that milk is starting to come in because she is in labor. Option 2. Complete a thorough breast exam and document the results in the chart. Option 3. Perform a culture on the discharge and inform the client that she might have mastitis. Or option 4. Inform the client that the discharge is colostrum. Yes, in this scenario, the nurse should inform the client that the discharge is colostrum, which is the first form of nutrient-dense antibody-rich milk produced by the female mammals during late pregnancy and the first few days after giving birth. Here, option 4 is the correct answer. Question number 3. The nurse explains to the client who is 34 weeks pregnant and is experiencing vaginal bleeding. In this case, coitus should be restricted because option 1 need to be modified in any way by either partner. Option 2 is permitted if penile penetration is not deep. Option 3, it may stimulate uterine activity. Or option 4 is safe as long as he is in side-lying position. Yes, in this case scenario, when they are 34 weeks pregnant and who is experiencing vaginal bleeding, the coitus should be restricted as it may stimulate uterine activity. So here option 3 is the correct answer. Next question. Which of the following positions should the nurse place the client when the epidural regional block is administered? Options are lateral, lithotomy, supine or option 4 prone position. Yes, for epidural regional block administration, the optimal position is one that flexes the spine, which causing the vertebra to separate and widening the spaces between them. And this is typically achieved in one of two ways, either of sitting position or lateral position. So here option 1 is the correct answer. Question number 5. Which of the following term is used to describe the thinning and shortening of the cervix that occurs just before and during labor? Options are ballotment, effacement, dilatation or option 4 multiparous. Yes, you are absolutely right. Effacement is described the thinning and shortening of the cervix that occurs just before and during labor, while dilatation is the widening of the cervix. Here option 2 is the correct answer. Question number 6. A 18-year primary gravida with severe pregnancy-induced hypertension has been receiving magnesium sulfate IV for 3 hours. The latest assessment reveals that BP is 150 by 100 mm of Hg, pulse 92 beats per minute, respiratory rate 10 breaths per minute and urine output is 20 ml per hour. Which of the following actions would the most appropriate intervention? Option 1. Increase the infusion by 5 GTT per minute. Option 2. Decrease infusion by 5 GTT per minute. Option 3. Stop the magnesium sulfate infusion. Or option 4. Continue monitoring per standard of care. In this scenario, magnesium sulfate should be stopped if the client's respiratory rate or urine output falls or if reflexes are feeble as it is a CNS depressant. Here, option 3 is the correct answer. Question number 7. Which of the following nursing actions is required before a woman is in labor receives an epidural? Option 1. Give fluid bolus of 500 ml. Option 2. Check for maternal pupil dilatation. Option 3. Assess maternal reflexes. Or option 4. Assess maternal gait. One of the major side effects of epidural anesthesia is hypotension. Therefore, a 500 ml fluid bolus is usually administered to help prevent hypotension in the client who wishes to go for an epidural for pain relief. So here option 1 is the correct answer. Question number 8. Priyanka is being admitted to the antenatal unit for hypovolemia secondary to hyperemesis gravidarum. Which of the following factors predisposes a client to the development of this? Options are maternal age more than 35 years, low level of HCG, malnourished or underweight client, or option 4 trophoblastic disease. Yes, gestational trophoblastic disease, it is a well-recognized direct cause of severe hyperemesis gravidarum as the molar pregnancy experiencing intense and unrelenting nausea and vomiting, which is often driven by the exceptionally high level of HCG. So here option 4 is the correct answer. Question number 9. A 20-year-old client 7 weeks pregnant is diagnosed with hyperemesis gravidarum. This excessive vomiting during pregnancy will often result in which of the following? Options are bowel perforation, electrolyte imbalances, PIH, or option 4 miscarriage. Yes, you are absolutely right. Hyperemesis gravidarum causes severe and persisting vomiting and dehydration, which rapidly deplete the essential minerals and causing electrolyte imbalances, specifically hyponatremia and hypokalemia. So here option 2 is the correct answer. Question number 10. Which of the following condition is common in pregnant clients in the second trimester of pregnancy? Options are mastitis, metabolic alkalosis, physiologic anemia, or option 4 respiratory acidosis. In second trimester of pregnancy, physiological anemia is a normal condition caused by blood plasma volume increasing by 20 to 30% faster than the red blood cell mass. Here option 3 is the correct answer. Question number 11. The doctor suspects that the patient has an ectopic pregnancy. Which symptoms is consistent with a diagnosis of ectopic pregnancy? Options are sudden stabbing pain in the lower quadrant, option 2 painless vaginal bleeding, option 3 throbbing pain in the upper quadrant, or option 4 abdominal cramping. With a diagnosis of ectopic pregnancy, the consistent sign will be there is a sudden stabbing pain in the lower quadrant. Here option 1 is the correct answer. Question number 12. The placenta should be delivered within how many minutes after the delivery of the baby? Options are 5 minutes, 30 minutes, 45 minutes, or option 4 60 minutes. The placenta should ideally be delivered within 5 to 30 minutes after the baby is born. So within the given option, option 2 is the correct answer. Question number 13. A 18-year-old is bleeding between periods of less than of 2 weeks. This condition is an abnormality in the menstrual cycle known as. Options are amenorrhea, menorrhagia, dysmenorrhea, or option 4 metrorrhagia. Metrorrhagia, which is commonly known as intermenstrual bleeding, is an abnormal irregular vaginal bleeding occurring between expected menstrual periods. Here option 4 is the correct answer. Question number 14. A client is receiving MgSO4 therapy for severe preeclampsia. The nurse must be alert for which of the following sign of excessive blood magnesium level? Options are increase in respiratory rate, option 2 sensorium stimulation, option 3 disappearance of knee jerk reflex, or option 4 appearance of cardiac dysrhythmia. Yes, excessive blood magnesium combined with an absent knee jerk reflex is a classic indicator for magnesium toxicity, as the magnesium acts as a central nervous system depressant and blocks neuromuscular transmission. So the loss of deep tendon reflexes is an early clinical warning sign that toxicity is approaching dangerous level. So here option 3 is the correct answer. Next question. Which of the following would cause a false positive result on a pregnancy test? Option 1, the test was performed less than 10 days after an abortion. Option 2, the test was performed too early or too late in the pregnancy. Option 3, the urine sample was stored too long at room temperature. Or option 4, missed abortion is impending. Yes, you are absolutely right. You will get a false positive result on a pregnancy test when the test was performed less than 10 days after an abortion, as the HCG level is quite high in this situation. So here option 1 is the correct answer. Question number 16. Which assessment findings would be the most unlikely risk factor for respiratory distress syndrome? Options are second born of twins. Option 2, neonates of diabetic mom. Option 3, neonate born at 36 weeks. Option 4, chronic maternal hypertension. Within the given option, chronic maternal hypertension is the most important risk factor for respiratory distress syndrome. So here option 4 is the correct answer. Next question. Which of the following answers best describes the stages of pregnancy in which maternal and fetal blood are exchanged? Options are at conception. Option 2, at 8 weeks gestation when the fetal heart is well developed. Option 3, 32 to 34 weeks gestation in third trimester. And option 4, maternal and fetal blood are never exchanged. Yes, in a healthy pregnancy, maternal and fetal blood are never exchanged. Instead, the placenta acts as a biological filter. Nutrients, oxygen and antibodies are transferred across the placental membrane while the actual blood cells remain completely separated. Here, option 4 is the correct answer. Next question. A 52-year-old lady comes to the physician because of concerns regarding menopause. The patient is started on raloxifene. On this medication, which of the following is this patient most likely to develop? Options are breast cancer, elevated cholesterol, hot flushes, or option 4, endometrial hyperplasia. Yes, at the stage of menopause, when the patient started raloxifene, hot flushes are one of the most common side effects that affecting up to a quarter of users. So here option 3 is the correct answer. Question number 19. Oligohydramnios is related to which of the following condition? Options are esophageal atresia, renal agenesis, anencephaly, or option 4, Down syndrome. Yes, you are absolutely right. The renal agenesis, that is the failure of one or both kidneys to develop, is directly causes oligohydramnios because fetal urine is the primary source of amniotic fluid in the second and the third trimester. So here option 2 is the correct answer. And the last question of this quiz session is, a patient 34 weeks pregnant arrives at the hospital with severe abdominal pain, uterine tenderness and an increased uterine tone. The patient most likely has which of the following condition? Options are abruptio placenta, Hyda TD from mole, option 3, ectopic pregnancy, or option 4, pelvic inflammatory disease. If a 34 weeks pregnant lady is complaining of sudden severe abdominal pain, uterine tenderness and an increased uterine tone, the probable cause of this is abruptio placenta. That means the early separation of the placenta. So here option 1 is the correct answer. So let me know how much you have scored from this video and also mention me in the comment the topic on which you want more MCQs and explanations. See you soon in my next nursing quiz session.